our single agenda item today, I would look for a motion to approve the construction of a Veterans Wartime Memorial from PA 214 funds not to exceed $200,000 and award the contract to EFC, which was formerly planned. Can I get a motion on that? I'll make the motion if I can get a support.
I'll support it.
Thank you. All right, discussion, we do
So,
have Mike.
Morgan, will you have Major Reeves come in here?
Yeah, I think it's too much money. I thought they're supposed to be helping the vets.
Well, here's our guy.
Did they get other bids from any other contractors?
I'll let Mike
No.
answer that.
Huh?
No.
Why?
With the poor showing that we had, just to keep everything above board with RBF, I just went with that one. I can look elsewhere if the commissioners would like.
So last time when we had work done on the other building, the other contractor had done their work and we had decided not to continue anything further with the one that remodeled.
Yeah, even when it was the bid at Kohanik or Meyer or Mallory or Perrin, they didn't get the bid on it, did they?
The other one, there were 3. I can't remember who they were. I'd have to go back and look in minutes and whatnot. RBF was the lowest, and that's the one that we went with. If you remember, one came in right at $1 million, and we were like, "Oh, that's way too high."
I think it's
At that time, so
I think the memorial's a waste of money. It's supposed to be helping the vets, but that's my opinion still.
okay.
My concern is, and I think I'm the only veteran on the board, but I'll tell you, I'm all in favor of having a memorial. But it strikes me, I look at the drawing here, and then I look at the pictures. I mean, it's a lot of money for what I see here. And I'm not saying this isn't big enough. I think I share Commissioner's concern that it's a lot of money for what we're getting.
Yeah, and the reason
I'm all in
we
favor of it, though. I think we should have it,
and the reason I went with 2 is because I don't know what I don't know right now for a memorial. So I basically took a dart and chucked it. Talked with our committee, that's what they approved. If you want me to go back and get with, like, I'll just pick somebody, not that we're definitely gonna go with this individual, but Mike's Monuments, and have them price out exactly what we want, I would then have a boots on ground number, if you will, that I could then present to the commissioners. Because right now it's a swag, I'm not gonna lie. It was just a, hey, this is what I think the total is gonna be. It has not been an estimate or a bid. So if the commissioners would like that, I can definitely have that done from a couple of different companies and then come back to you all.
Yeah, for example, this picture that's attached to your presentation that shows, I guess, a representation of what it would be. And I appreciate it, now includes Coast Guard and Space Force, so we now got 6 departments, 6 armed forces. Where was this? This apparently is some other location, a similar kind of memorial, is that what it is?
Correct.
Yeah. And
This is just a complementation, I can't say the word correctly. All different ones put together. Thank you. Stuck together, so it's not a definitive. It's just something that I presented to the committee, and they liked the design. So we then went and asked Creekwood to do a representation, which they then put it all together. But yes, it would be that first picture with some pillars representing each of the organizations, Army, Navy, Air Force, etc., followed by brick pavers around, and we would sell those brick pavers to help offset some of the costs within the community. And then you have the memorial itself with the different wartime eras presented. Dr. Boggs did point out that there were some other ones that were not listed. Those would be listed as well. And then instead of this black onyx or marble top piece, it would be the soldier's cross, which is a typical, so.
Yeah, and I like that part of it. I'd like to see that.
Yeah.
I did ask that they adopt the list from the Veterans, from the Federal Veterans Affairs that lists every war and how they characterize it and name them and the dates, so that it matched these federal listing.
Yeah, and so it could be tied back to federal record instead of just best guess. And there are different sites that have different numbers. We are gonna go with the Department of Veterans Affairs, America Wars, and their casualty list that they have, so.
I've been on the board when they just had a little room upstairs and didn't even have a car to drive or nothing. Now all of a sudden they're getting a Cadillac room and all this money. I think it's a waste of money, and I think the taxpayers wouldn't like it myself if they had to vote for all that. If you guys got that much money to spend, it's a waste. It's supposed to be helping the vets. That's my opinion, so.
I take a different view. I think this is a very good idea. I think it's something we should do. I just would like you to take a closer look at the numbers for what we're getting.
Sure, I can do that.
That's
So
fair.
You could amend your motion to table it until next month for the committee to have a more complete proposal.
Yeah, I mean, I would be supportive of amending the motion to table it till next month and get a better handle on the numbers.
I'll second that.
All right. Anything else you wanna add, Mike, or anybody else? All right, all those in favor signify by saying aye.
Aye.
All those opposed?
No.
All right, so that motion is tabled till next month. You're welcome. All right, that brings us to our second call to the public, and seeing no one, we're adjourned.
Call the Public Safety and Courts Committee. Start with the Pledge of Allegiance. Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
It's the time for a call to the public with anybody who have comments. Seeing none, we'll move on to the agenda items. First item is a motion to approve the replacement of one correctional deputy not to exceed step 3.
So moved.
Second. That's me. Second.
So we had one corrections deputy leave us. It's a budgeted position. This is to post for the replacement of that position.
I had just one question. It doesn't seem like you've had a lot of turnover lately.
We actually had one go to the road from the jail,
Oh,
and
okay.
then we had one, leave that was a couple months ago, so yeah, that's
Okay.
it.
Well, that's good, right?
Yeah.
Okay. That's all I had.
Any other comments or questions? Hearing none, all those in favor say aye.
Aye.
Opposed? All right, the next matter is we need a motion to approve the proposal from D Squared Concrete and Construction in the amount of $174,000 for a new parking lot at the county 911 facility.
So moved.
Second?
If I could just make a comment, that's 174,400. That was a kind of a typo, so.
So it's 174,400.
400, yep.
It's not with the,
I accidentally did a typo on my request, so
okay.
It is 400 now.
Yeah, she says it's 400. And so Angie, do you want to present your?
I'll second.
Yeah.
our parking lot, we tried to resurface it several years ago and it's just not holding up. We have a lot of cracks, weeds going through the cracks. The entranceway is always flooded with water anytime we get rain, and it's just constantly washing away our entranceway, so I know it's a lot of money, but, I feel like it'd be a good investment, because if we do this, I feel like it's probably gonna last us hopefully 15, 20 plus years, so this is something that has to be done, unfortunately, but, we had several bids, and the 911 board met, and we felt like this was the best option. So,
Just curious, who decided on the specs to put out the bid?
we had, I had a board member.
Jerry Gutting, he's the supervisor of Antrim Township, and he does excavating, so he kind of took the,
Okay, so you got somebody who definitely knows that sort of thing to do
Yeah,
the specs.
so I asked for his input because I don't know a whole lot about concrete work and things like that, so he offered to come in and kind of help me, point me in the right direction with bids and stuff like that. So-
and he met with the contractors, correct, on the site, and he was gonna, they're also gonna do some work with a drain
At the-
underneath,
At the
and,
entrance,
yeah, so,
Alleviate the flooding.
yeah, there's no like ditch there, real good drainage system, so the water just all sits right up front there, right off Corner Ave, so.
I have a question. I guess I wonder who suggested that it will last for 20 years before any work will have to be done again. Is that?
Going by what you,
possible?
yeah, that's what, he said doing the concrete, cause it's gonna have the wire underneath of it too to help hold it up, the rod. And, he said it
It'll
should
have
last.
re-rod in it,
Yes.
but
Mhm.
concrete, I'm no expert in it for sure, but concrete does crack over time. It can have varying consequences, but is D Squared a local?
Yes, they are out of,
Corona.
Denver.
I thought it was Dorian.
They're in the county.
They're in the county.
They are
yes.
local.
Jerry indicated he'd worked with them before. I'd never heard of them, but they did have 2 other bids, so.
This was the lowest bid.
They're all, we felt like, as far as the square footage of the parking lot, that they were the most accurate from our measurements that we had ourselves. So they weren't necessarily the lowest, but we feel like the most accurate, if that makes sense. We also had a bid just to get the asphalt and sealing done, rather than doing the concrete, and that was just about as much, so that was $171,000 to tear out and do that, so.
So it wasn't the lowest, but you feel it was the most accurate?
Yes, I mean, they were all roughly not too far out from each other. I had one for 178, 557. The one, I had one for 150,000, 404, but that was the one that we felt was way off on the square footage that we actually needed. And another for 189, so they kind of fell in the middle of what we were seeing. So.
Any other questions or issues? All those in favor say aye.
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 Thank you.
And item C is, I need a motion for approval, to approve the contract for Advanced Correctional Health Care, Inc. in an amount not to exceed $287,296, and authorize the board chair to execute the same.
So moved.
Second.
So Tammy Wilson is here as the jail administrator, and part of this is the result of a change in licensing and regulations from the state about whether they can use LPNs versus registered nurses. And because of this change, they feel that it has to be a registered nurse, which increases the amount of the contract from 197 to 287 per year for this. So, and this is a mid-year contract, as opposed to some of our other contracts that are on a cycle of January 1 to December 31st, which means that the difference is a $90,000 increase, but it will only 45,000 of that would have to be absorbed as unbudgeted for this fiscal year. I've had some discussions with the undersheriff about this, because the $45,000 being unbudgeted will have to come from somewhere. There's a potential that there may have to be some reductions in the sheriff's budget, but another potential solution is using some of the opioid funding if we can make a case that at least 15% of the service, which was 45,000 out of 287, is used to treat drug-related issues, which I don't think is going to be a terribly heavy lift. 15% is not a high threshold. And then next year, we could find a different way of budgeting for that $287,000. However, we don't have to make the decision related to the 45 today, but it is something that you need to consider before the end of third quarter, because any cuts would have to happen in the fourth quarter.
And this change is a result of some state policy change?
And I'm going to ask Tammy to explain that.
I'm sorry for my attire. I was on my way home, so I would not normally dress
So
like this.
she had asked if she needed to come tonight or not, and I said no, but then a couple of commissioners had some questions, so I did ask her to attend, so that's my fault.
So historically, we've always had LPNs, licensed practical nurses in the jail, and apparently there's been some litigation indicating that LPNs are not authorized to do medical assessments, and that's what they have to do on the inmates. There has to be an RN.
Could I ask you a question?
Sure.
You're manning there, on each shift, how many LPNs do you have?
I have actually 60 hours of medical nursing. So that means there's 2 LPNs currently. Well, actually one, because one resigned. 2 of them, one is a part-timer and then the other's full-time. So they are there Monday through Saturday, like 7 to 5.
60 hours of coverage in
A week.
in a weekly period.
Okay, so you, and do you have an RN now?
We have a part-time RN that they hired, and then today they hired the other full-time RN.
Does this proposal anticipate a one-for-one replacement of the LPNs by RNs?
This increase is due to the RNs, replacing RNs with the LPNs.
There'll be no more
Correct.
LPNs.
Correct. My full-time nurse is done September, the 30th of this month.
My question is now, LPNs can do, if you look at state law, LPNs can still do some things. For example, they could administer drugs, biologicals and intravenous medications. They can get involved with administering controlled substances, for example. I mean, there are some things they can still do that might relate to jail setting. And my question is, are you saying that you're not gonna have any LPNs? You're gonna have it all done by?
That is the company's choice. I mean, there is some jails that do have LPNs and RNs, but the RN has to oversee that LPN.
Yeah, yes.
And ours is not feasible because of the fact that the part-timer right now, who would be the RN, she'd have to do all the medical assessments. And they gave a choice to the LPNs that if they wanted to stay, then they would have to continue education for the RN.
Okay, so they did give them that
Yes.
opportunity?
Yes.
As a contracted company, and we don't provide, in a larger jail setting where you might have more people on staff than 60 hours worth in a week, where you might have 2 or 3 nurses, or 2 or 3 healthcare providers, you might be able to have 1 RN and then a couple of LPNs for them to supervise and do those kind of things. But right now, we only have 60 hours total between all the employees that provide that service. So with only 60 hours, there's no one for them to quote unquote supervise, so they have to be the RN, is how I understand it.
Correct.
Yeah, I was just concerned that maybe the cost might not be as great. But this is contracted, so we're paying whatever the contractor decides
Correct.
they want.
Correct. And when he did present this to me, it was based on a higher population in my jail of 132. That's what my bed count is. So they are readjusting that lower because I haven't had that bed count in a while since COVID. What's that?
What's our current number around?
We average between 70 to 85. So I think they're gonna kind of do it around 90, 95, so that might bring it down a little bit. They haven't gave it to me yet. They said they'd get it to me this week. So that might change that a little bit.
That won't affect your proposal though, because this is not to exceed
Right.
in the language, which would be better. And since COVID, they've done several different things, including some bond reform items that have changed the jail population.
Tremendously. Tremendously, yeah.
So is there any funding coming from the state to make up their new requirements?
That's not how it works.
And I have tried to pursue different avenues by looking at some of the what other jails are using. There's not a lot of vendors out there right now. I did contact one place where Monroe County has advanced and they got rid of them because of this. This company was VitalCore, but they said they've already made their quota this year for corrections and it would have to be a 24/7 medical. So it would cost us more if in the event we did change to them. So, yeah, there's not a lot of options out there other than hire our own doctors and nurses, but then again, you're gonna be probably in the same amount.
That's a difficulty because
Absolutely.
even our public health department has
Yes,
problem hiring
right, right.
RNs. So you basically, for us, this is the most economical
That I know
way
of.
that's feasible, is
Yeah.
what you're saying.
Yeah, that I know of. And it does give us, even though we only have the 60 hours of medical, we do have an on-call doctor that the officers contact after hours 24/7, so, which is very helpful.
This is different than how these things have changed over the course of time. What was it, 20 years ago or so, we actually employed our own nurses and different individuals directly. And over time, this and several other services have been outsourced or replaced because of cost savings.
We have a constitutional requirement to provide the prisoners health care, and we would be liable, so.
Absolutely.
All right. Any other questions?
Yeah, just, so this contract includes that on-call doctor?
Oh, yeah, yeah, that's included in it.
Is that something you have to use very often?
Oh, yeah.
Okay.
Actually, I think my officers use it about every night. Seriously, because, you get these inmates that come in, inmates or whatever you wanna call them, come in and they're under the influence of something, they've got headaches, stomach aches, been in accidents. There's a protocol sheet that they have to fill out for each type of injury. They contact the medical provider, give them all that information of their history, their blood pressure, everything, and the doctor makes a call. What happens? Give them this, maybe they need to be sent to the hospital. So it kind of takes the liability off us a little bit, even though the doctor don't see them.
I did not expect you to say every night. Wow, that's a lot.
Probably,
Or that often.
I would say at least 3 to 4 times a week.
That is
for
a
sure.
lot.
Yes.
How many of the people that are being arrested aren't just being arrested for run-of-the-mill drunk driving or some of the other stuff? That stuff happens too, but a lot of them are experiencing
Withdrawals, drugs,
withdrawals
mental.
or whatever you would call it when you're coming down from crashing.
Mhm.
Anything else?
No, that does not sound like fun.
No.
All those in favor say aye.
Aye.
Anybody else from the public to comment on public safety in courts? Seeing no one, we're adjourned.